Do you get dizziness or feel lightheaded when you move your head? Or do you get dizziness from just rolling in bed? Or do you notice your eyes are jumping back and forth whenever you feel dizzy? Hi, my name is Quentin. I'm a physiotherapist here at Pain-Free Physiotherapy and Allied Health. I'm going to talk about benign paroxysmal positional vertigo, or BPPV. BPPV is a condition that can occur more often as people get older with degeneration, and is generally caused by a disruption of the small crystal rocks in our inner ear. Now, these small crystal rocks are called otoconia, and they are small calcium carbonate crystals. Now, when these crystals are dislodged, for example, from head trauma, these crystals can float into other areas of the inner ear and create mixed messages to your brain as your head moves. Now, this is due to disturbance of the fluid flow in the ear canals, which are responsible for sensing head movement, orientation, and balance. In many cases, people can report dizziness or vertigo, loss of balance, nausea, or lightheadedness. But not everyone will be the same. People will find different activities that trigger the symptoms. However, most triggers have an element of head movement. Usually symptoms last for less than 1 minute as the crystals in the fluid settles. However, there can be some cases where symptoms last even longer and may resolve when the head is moved back to a non-aggravating position. Nystagmus is also a type of symptom that is seen in people with BPPV. So nystagmus is involuntary eye movements, which can be in any direction, so left, right, up or down, or a combination of these going diagonally. So the direction of the eye movements is dependent on which canal the crystals are in. And these cues can help allow trained health professionals to correctly identify and then treat your condition. It is important for your GP to diagnose BPPV correctly, as it has been frequently misdiagnosed as Meniere's disease. This is because people do not realize the effect of head movements that triggers vertigo, and both of these conditions can display vertigo, nausea, dizziness, or vomiting. Therefore, it's important to have a detailed history of what happens whenever you get these symptoms. Doctors can also prescribe medications such as Stemetil, and this can help with the nausea or vertigo, but it doesn't actually resolve the BPPV. The key thing for BPPV is early diagnosis and treatment. This is because it can be quite debilitating and deeply affect your everyday life, psychologically, affect relationships, or just your quality of life in general. It is important to identify what is causing the dizziness or vertigo symptoms. Usually there are two common types of dizziness. It can be cervicogenic, meaning it originates from the neck, or from BPPV. If it's cervicogenic, we can go through a process that assesses the muscles and joints of the neck. And often we find that people with cervicogenic dizziness have poor joint repositioning sense. This means that when we move your head out to the side, and ask you to bring it back in the middle with your eyes closed, it's not as accurate going back to the same position. On the other hand, BPPV can be differentiated from initiating certain test maneuvers that involve changing the head position and lead to reproducing the dizziness and other associated symptoms. Now, it's very important to be aware of what is going to happen with this test procedure. So we will explain step by step what we're going to do, what could happen to you, and what you may feel. So one of these tests for BPPV is called the Hall-Pike-Dix test. Now, reproducing your symptoms and nystagmus can then determine which side and which canal the dislodged crystals are in, and then provide the correct treatment. Now, one common treatment technique is called the Epley maneuver. This is quite similar in terms of how BPPV was assessed, and this can also trigger your dizziness or vertigo. So the main purpose for this technique is to reposition the crystals back into the right place. Now, here is a video of our principal, Rick, performing the Epley maneuver. The Epley maneuver can also be taught as an exercise to do at home to help maintain the treatment progress. Usually, BPPV can show quick improvements after a few sessions with the proper treatment. BPPV can also have associated muscle and joint problems. So as part of the initial assessment here at Pain-Free Physiotherapy, we are experienced at using a holistic approach to assess the body as a whole from the head to your toes. And for many cases, we find that the neck muscles or joints have also been affected, or even the shoulder, such as the infraspinatus muscle. Now, there may be some instances where we find that your dizziness or vertigo is not actually caused by the neck or from BPPV. Then this may require further referral to specialists. So, if you are experiencing dizziness, episodes of vertigo, nausea, or vomiting, or know that you have BPPV and aren't getting the results that you want, feel free to contact our clinic. We'd be happy to answer your questions that you have about BPPV.